Transformation surgery of the Weber type 7b without a patella. So transformation, as you have seen in the previous videos, is a very nice tool to give a malformed leg good function. Type 7b is the most severe form, where the tibia is completely missing. There's only a fibula and a foot, and without patella we cannot use the technique to use the patella as a knee joint. We have to use another technique which I want to demonstrate now. So here's the femur, the fibula and the calcaneus. More is not there in these children, and there is a ligamentum capitis fibulae which is usually there and which can be used to stabilize the knee we have to construct. And in the first place we have to do soft tissue lengthening in order to bring the fibular head under the femur condyle, and the distal part of the fibula has to be put above the foot. And then we get this situation. We use the ligamentum cruciatum, we use the ligamentum capitis fibulae as ligamentum cruciatum. That means this ensures that this part of the fibula, the proximal part of the fibula, stays in place of the femoral condyle. And later, with the movement, this will give the tissue the force in order to adapt to this situation. And this head is made of cartilage, so it can grow into a kind of knee joint. And the foot, of course, has to be centralized and stabilized with periostal flaps. And furthermore, we have to apply a muscle. The muscle is there, and we have to apply the muscle function to this lower limb. And number one, we have constructed cruciatum ligament. Number two, we have to construct a collateral ligament in order to improve the stability of the knee joint. And then we use tendons to bridge area between the muscle and the lower leg. So with this, the motor is given to the lower leg, and then the patient can extend the leg. The flexion is always there because it's attached to the fibula anyways, but the extension is missing. Therefore, we have to construct this. Okay, this is the first step of the treatment. A child, female child, which need to have both legs done. Tendon lengthening has to be performed. This is the X-rays of the legs before the surgery. This is after surgery. Here you can see on the X-rays that they are very nice aligned, yeah, and here the bones adapt already to each other. They're getting wider and start to develop knee joint. And this is the child. She can walk, she can run. She has, of course, orthosis. These children need to have longer time orthosis because these are braces, because they have to develop a knee joint. This takes much longer as with the other techniques, but it's still working, and very important that these knee joint always have a range of motion, so that there is enough stimulation for this tissue to develop a joint. This can be supported here with some tricks on the braces using rubber bands to improve the extension, because at the beginning the muscle is weak and he has to be trained. Here an intraoperative video showing other patient where we also using these rubber bands in order to help the extension of the new constructed knee joint. Everything what I have told before is realized in this patient as well. So form follows function. Once the fibula is transpositioned to take over the function of the tibia and the foot is centralized, it develops a knee joint, ankle joint, or at least a stable arthrodesis. And the fibula is growing to the size of a tibia, and it's growing by itself due to the fact that it has own growth plates. Here this is another patient who was treated like this, and where we can prevent him from amputation. He should get amputation of both lower legs in Turkey, and you see, meanwhile he knows where my office is and can walk to my office by himself. If you're interested in more details, I published several chapters in these books. Thank you for your attention.